Hello and welcome to yet another episode of You Are Human. I'm so grateful to each one of you for tuning in. Today, joining me is an Omani physician and psychologist. She works with the Ministry of Health in Oman and is also a psychologist for an American virtual organization called Betterhelp. She has done her research study on post-traumatic disorder that is faced in women suffering from breast cancers and is also an associate professor in a university in Arizona. Please welcome Dr. Nashat Shams.
Thank you very much for the introduction. It's a pleasure to be here.
It is such an honor to have you here today, Doctor.
Same here, I felt like that.
I want to come straight to the point. With a lot of work and a lot of campaigning, there has been a shift in talking about mental health. There is so much awareness today, and people are not shying away from seeking therapy, seeking help. Unfortunately, we have been faced with this pandemic, this challenge, and now there are more and more people who are A, suffering from mental health issues, and B, coming out to seek help. I just want to go back a little because you have practiced for so many years. How has this shift come your way? What do you think about this shift in acknowledging mental health issues and seeking help?
Okay, that's a nice question because this is always a dilemma for our individual, normal people to seek professional help from a psychologist. Now, one thing I want to clarify on this, that if you look at the United States from where my training is, it's not a fashionable thing, but it's an acceptance and acknowledgement that if there is a problem, we can seek help professionally. Right. We can go to a counselor and psychologist. Our field is no more restricted to depression, anxiety only mental health. Right. We help people with a professional problem, a marriage problem, couple issues, employer issue. So we have really vast ourselves in different aspects of life. Having said that, unfortunately, in this pandemic, you're right about that I am seeing a lot of population across the world because the Betterhelp give me an opportunity to do that. So the number of people seeking professional help from in United States, in UK, in the western part of the world is still quite high.
Right.
Coming to Muscat, which is a Muslim world, people are a bit hesitant to seek help still. And one reason, Jagruti, what's happening is it's become a very strong stigma that if you come to me for any reason that, she considered as that she has some kind of mental disorder or she has a weakness in the personality. Now, that is more like awareness and educational part, which we are working. So there is a significant number of the people coming to me who are Omani, but they are very less, I would say, accultured into this community in Oman.
Right.
And the second is they're well educated from abroad. They have a good spent their time outside the country, so they are well aware of the importance of the counseling or this.
Right.
But if you come, people living in the remote area, I think people are still very hesitant.
Right.
Just giving you an example. I myself, and I want to acknowledge here in this platform that I had a very severe depression. In my medical college because I failed in the exam, and I came to the point that this was a severe clinical depression. My own family were not ready to take me to psychiatrist. Considering that she's becoming a doctor and tomorrow she might not get married because if people comes to know or the family member come to know. Right. So this stigma is quite strong, though I'm coming from an educated home and all that. And I think that was also a turning point in life that get into this profession.
Yes.
So coming back to your question, you are right. We have seen a significant number of people in the COVID. Omani people, Muslim population is also started seeking help, but the numbers are less still.
The numbers are less. So I think there is still a long way for all of us to go to remove this taboo, because you said there is still the stigma. So do you think that it's still a long way ahead? It's still a long battle?
I would say it is a long way, you're right about. However, this also counts that who they are going.
True.
Now, if they're going to a white American English psychologist, our approach will be very different. But if they come to people like you and me who can assimilate with the problem, we can relate to them, probably people start getting comfortable more. People who comes to me in Omani, they know that I understand the language, number one.
Right.
I understand the culture, and the cultural identification, I think it's really helpful.
It's very important.
It's very
as well.
important.
Yeah.
So I would say that the nurses in the hospitals, if they are being educated about the counseling, they can help. So we can start like more awareness program, rather just considering that when you have a severe depression, then you see a psychiatrist.
Right.
Why not to kill this battle or to win the battle before the child or the person is going to go so late.
True.
So I would say, yeah, it's a long way to go. You're right about that. But I'm very hopeful because I am seeing people.
Yeah.
And the awareness is the main thing.
Right.
I hope the country let people like us to create this awareness.
Right. And I'm so grateful to see that there are so many young people getting out there and talking about it, because these days social media is a platform where people let out their emotions. They even share, about their journeys. And I'm seeing so many of them coming out and accepting, like even the way you did right now, you accepted that, hey, you know what? I did suffer from depression in my early years. So I don't think maybe 10 years before, even 5 years before, 5 years back, people would come out so easily and talk about it. But now I think because it's a subject that people are being more vocal about, there is awareness, so people are getting comfortable with it. They're
That's
no
true.
longer hiding it.
That's true.
Yeah.
I mean, the Muslim population, or probably people coming from the South Asian, they are very Jagruti knitted with the family network.
Right.
So if they have a problem, it's always to talk with the family.
Talk with the family.
Talk with the imam, religious person, or talk with the friend. Now, particularly the woman is seen showing her internal conflict in her family to other people. It's something, it's still a taboo and a stigma. Women particularly, they won't go and talk about her very personal issues with psychiatrist or psychologist, and finding the trust with the person they are talking. So coming back again, it's lots of awareness and education that we need to give them.
Absolutely.
Because it's not, when you come to me, I am not having a social conversation with you.
Yeah.
It's not.
Yeah.
I am providing you a skill,
right,
which is research based,
right,
and that skill you're going to carry all your life.
Absolutely.
So it's a different approach that
Yes.
I'm going to take from you're going to take from me.
Right.
So and therefore, I think after this probably platform, people might understand that it is not only depression and anxiety that you need to come to me, or people come to us.
Yes.
People come with very minor issue. And if I'm not over the board, I just want to add something. Recently, I met a lady and she's very educated. And she said, "Oh, I don't need any psychologist. I'm so well doing." And then in the middle of the conversation, just a discussion, she said, "You know what? I hardly could sleep in the night." And I was like, "Oh, what is happening?" And she said, "If someone said this to me somewhere, somebody said to me the whole night, I kept thinking about it," which we call as a rumination. She has been with this for a very long time. Now, this is an area where we can address it well.
Right.
But how you can mellow it down, how you can numb it. And these are the small things.
Yes.
But if it's not being addressed, then I think it gradually
grows into something else severe. Yeah, I think there is so much that we probably go through, but we're not sure that this categorizes under a mental health problem. So we just think, oh, okay, this is something I'm feeling. But if it goes on for a repeated, days or years, I think then professional help is the answer.
I mean, you don't want to wait that the worst to come.
Right.
You want the kid when he's suicidal, the kid when he's ready to jump out of their
Oh my God.
that is the time they give a call.
When it
So
was
I would
already
say, Nib,
so
that
late.
yeah,
So late.
it's quite late. So the medication kicks in. But if there's a conflict in the family, that is the time
That
probably you
is
could
true.
address it. And not
Absolutely.
necessarily you need to be with us like a psychologist and Kitty take this label, but at least you might get some kind of tool from us
Yes.
that you can apply in your home and
Yeah.
things you will see a change.
Yeah.
Because this
yeah.
is like a research-based thing that we start working
No,
on.
absolutely.
It's,
Absolutely.
so the few things that needs to be taken care now rather waiting
for the worst
for the worst to come.
Yeah, makes sense. And I think we need to acknowledge those early signs, and we are supposed to pay attention, be it with your family or your friends or your colleagues. If we see any kind of signs, at least we can talk to them or request them to seek help, because that will be the right thing to do.
Guide them.
Yes,
Yeah.
to guide them.
The problem is that we all start giving lots of suggestions.
Yeah.
And
when
then
when we are not even authorized, or we don't even have any credentials for that.
But I think this in a good faith people are trying to help each other
we do,
in
we
this.
do. Yeah.
But I saw significant number of people in COVID starting from 2020 early till now. Now the shoe's coming with the post-COVID.
Yeah. This is actually going to be my next question, because COVID is something, or a pandemic is something none of us were prepared for. We've never lived our lives in restrictions, in lockdowns, in virtual meetings. Okay, virtual meetings would happen, but not at this level. Kids are studying at home, in front of their laptops. They're not meeting their friends in person. We are not even meeting our family. Some of them are stuck in a country. They can't go back home. So there's so much that we are battling with, which none of us were prepared for. Yeah, these challenges. So I want to understand, I'm sure the numbers would be so high of patients, coming to you. But I want to know, what are the, maximum number of concerns or problems that people are coming to you for? Is there a similarity in everybody's problems or concerns, or every case is a unique case?
See, Jagruti, every person is a unique person.
That's true. Yes.
So coming back to your question, that what maximum statistically I am seeing. So I would categorize it as children, adolescent, and adult.
Children being number one?
No, I mean, categorizing that way. Okay. So one thing is prevalent across the board, and that is the anxiety. Now, when you said that yourself, we don't know, we never have been in that kind of situation. Right. We don't know how long we're going to, uncertainties. Then comes the lockdown, helplessness. Yeah. This brings the anxiety, which is the worry. Oh, what's going to happen tomorrow? And how I'm going to do that? So that's the worry. So we will not stay in the present moment. Either we are in the past or we are in the future. That's true. One thing. That's true. The second number is what I'm seeing is a depression. Depression. Now, depression comes in a different mode. You might be having issues going on with your emotions, but you have been coping on with it. You might have a problem with the family, but you're still been coping because you are out of the house for some time and you are busy with your life, you have friends. So this underlying vulnerability, which you never see it on openly, you've been living with it. Yeah. Pandemic and COVID brought all these internal vulnerable emotion on the surface.
Yeah, that's true.
Now I have nothing to do with this. Now when this is going to go. Now, from the medical point, depression and anxiety is like a brother and sister because it is the same chemicals working together. So the people who have anxiety, they also come with depression. Yeah. The sad thing, what I'm also seeing, substance abuse. People become more alcoholic. People start drinking more. Domestic violence. Now, I give an example. Let's say if I and my husband is having issues, but I'm working and he's working, we don't get much time to be around. And now the children is in home. I am full time. I'm struggling with and battling with my own job and my issues. He's having with that. So the conflict, which was kind of staying with arguments, become with the physical aggressions.
Oh no!
So this
That's
is
so
this
sad.
So this pandemic, and the last thing is, I would say, it's like a post-traumatic disorder. And when I say post-traumatic, people had this, let's say 2020, the first time we got hit it, but people are struggling with the trauma still now.
Oh
It's
my
still the
God.
people coming to me, especially women, and say, "What, Dr. Shams? I know I'm vaccinated, but what if I happen to me?" And
Oh, so that
okay.
fear of
And
getting
that is a part of the
COVID.
anxiety
Oh,
to gain the COVID, or I lost the job. Yesterday I got a
or
call.
what if I will lose my job?
Or
That
if I
also
will lose the
happens.
job. Yesterday, this is a very fine family. She just picked up the phone and she said, "I hate to ask you, but can you help me financially?" And I was saying, "I mean, what kind of help you need?" And she said, "I'm here with 3 kids, and this is happening in Muscat. 3 children. My husband lost the job. I lost the job." And I got a car accident. Car is in the repair work. How do I get help here? So the people start pitching it. Now, is this, you think, is not enough to bring a lot of emotional
That's true.
instability?
That's true.
Now, the people, personality-wise, if you are weak, so you are definitely a classic example to get into the depression, anxiety.
Yes.
But if you have some coping skills and you, by personality, you're a strong person, probably you're going to cope with it.
Right.
But the vulnerability, uncertainty, the trauma that we're going through, this lockdown that we are glued to the table all day, I think these are the ones. So depression, anxiety, post-traumatic growth, post-traumatic disorder. What else? Eating disorder. People coming to me that I am either I'm eating crazy or
I'm not eating at all.
and that comes with your stress.
With the
Stress is again. So the stress is number on the top, and then it has different branches.
Absolutely.
So if you address the stress, probably you might be able to work on that. But if it is it's not being addressed in a healthier way, then probably the extreme spectrum of that is anxiety, or the extreme is the depression. Did I answer your question?
No, absolutely. Okay. I'm just, all my thoughts are getting intertwined, and I'm just
you must have people met that have been talking about
no, absolutely no, and because I'm seeing some people around me, because what you're narrating, I can see them suffering from such things, so I can just so relate to it, and then it just gives me a sense of sadness within me at the moment, because that there are so many more people going through the same thing. So it's so unfortunate, and I wish and pray that everybody gets more strength to deal with this. And please, please, please talk to your family, talk to a professional, talk to anybody. Give time to yourself, and I'm sure, and we are sure that this too shall pass. So, let's just stay strong. You were even talking about that there are a lot of children.
One last thing. One thing. What I'm also saying is, I just want to add. Let's say somebody has this COVID, or let's say somebody has into the lockdown. Now this becomes more worse. Because I am then isolated. I am very lonely. My own loved ones, my family members, they can't come and see me. Because I came from India. I went to India for my mom treatment, and then they put me in the quarantine. I was in the hotel for about 9 days, and then I got another PCR. One time is negative, next time it was positive. They said, okay, and next another. So almost 15 days. Without my family,
of
in
isolation,
a hotel room, in isolation,
in a place that you don't know, and then you're eating hotel food, and then it just
that's another
plays
nightmare. But imagine that. Now, if I'm a person where I have emotions weak and I am vulnerable, regardless of whatever happening, then I'm a very good candidate to severely fall into depression, anxiety. Even in that kind of situation.
Yes, absolutely. You even talked about having a lot of teenagers as your patients. Would you say, if you had to statistically say, the number of cases of teenagers, where does it come? Is it number one? Like you get maximum cases of teenagers and children at the moment? Or is it still adults?
No, it is still the adults, and in adults, I think it's still the women.
It's still the women. Oh,
Women
okay.
somehow coming up with and there's a reason for that. Now, coming to your question about the teenager, I can't place exactly the number, but one thing is for sure, I was not seeing so much depression and anxiety in the teenager what I am seeing now. Most of the teenagers, as a psychologist, I was seeing they were having academic problem, behavior problem, conflict with the mom and dad. Now they are coming, and this is without exaggeration, quote to quote. This 11 years old met me a few days back, and when I asked what is going on, how you are here, and exactly he said to me, "I don't want to live anymore, and I want to die. Life is very boring for me." And this statement is coming from 11 years old.
Oh my God.
And you can imagine how heartbreaking and devastating it is for the family. We don't raise our children and when he's 11 years old, he's coming to me and telling, and he was sitting in front of me. And this is not one statement. Now, this is just he wanted to do. The next level I saw that he grabbed something and he had it or she had it. That's also happened. So unfortunately, and but these are the kids who lack the coping skill. They don't have the emotional strength.
Right.
The COVID hit them hard. So imagine that if there is a town where buildings are not well developed,
they will definitely fall off. Earthquake.
An earthquake. Now here comes my role. This is what I always think, that why not to build the buildings in a way that next time if the earthquake comes, they're resilient.
Absolutely.
And that is where our role comes.
True.
So it could happen that another crisis comes in life. So now you have the tools.
You have the mechanism to cope with it.
One time, we rubble and everything is crashed because of this earthquake. But why this has to happen second time?
Yeah.
Why not to become probably not only resilient, more stronger.
Right.
Than the resiliency.
Right.
Because resilience will bring you to the same baseline.
Absolutely.
And I wanted to see my patients or my clients not resilient, but more empowered.
100%. 100%.
More growth. And I think that is where you become a different person. And that is where my own research came.
Yeah.
So.
Yeah, no, absolutely. When it comes to children, and I'm not saying that parents are always to be blamed. Parents are human beings too at the end, which we tend to forget. And we just say that, oh, but the parent should do this and parent should do that. And I'm sure a lot of parents are also going through, their own mental health issues. But it so often happens that there's a gap between communication between parents and children. And in today's day and age where we're handling tablets and phones to our children and not giving enough time to them, in-person time to them, we tend to see this gap increasing. And if a child is going through something, he or she is not comfortable talking to their parent about it. Even if a child is, say, bullied in school, or the child will not come and speak to the parent because he doesn't want to annoy the father or, take his time because he's too busy. So what can a parent do in order to be that friend or be that comfort zone for the child? I'm sure it's not like one solution, but because there are a lot of people listening to this or watching to this episode, how can they be that better person or that go-to person for their child? Because you mentioned that a lot of kids are getting to the edge of getting suicidal thoughts or, taking that, worst step, which is so unfortunate. How can, parents go back to their children and create that bond?
Okay, Jagruti, one thing is for sure, I want to assure every parent sitting, including myself, that if I lose my temper and if I am very emotional and I'm not coping well because I'm tremendous stress, that does not translate that I am not a good parent.
Right.
One thing. My parenting should not be challenged. Yeah. I'm a psychologist. I get mad at my son and they say that, Mom, are you a psychologist? I said, yeah, but I'm a mother also. So that is absolutely, we cannot be very judgmental when to the parenting. It's a tough deal. Yeah. First thing. The second is to every parent and every mother, if they are listening, And when you realize that I am under stress, I have to do a lot of my work. I probably lose my job, and particularly in this COVID situation, I have to take care of the house and all that. If you become aware of your own emotions, if you learn to become self-aware of what is happening with me, probably you can pull yourself from the situation and handle it in a better way. So the first thing is this: be self-aware of yourself. What is happening with me? So for like, let's say, coming to my own son, giving an example, that if I'm working on something and he is coming and say, you know what, yesterday happened this, and I say, yeah, I know this happened. No, I'm not saying that. So I am not listening. So the first thing is validate the child feelings. I know you are going through this. I can understand that. But do you mind giving me 5 minutes so I can then come back to, and then we can talk?
Right.
So what am I doing here? I am just giving a gap on my emotions, but giving him a message that I heard you.
Yes.
I understand your pain. Because the same kid, until I won't say that, the same kid will keep saying, no, this is not the mom I'm saying. I am saying this. And I'm saying, you just go away. I'll talk to you later.
Yeah.
Well, I'm not validating. So the first thing, validate what he's saying. Validate the emotions, not the words. I know you look very mad on this. I understand that you are frustrated by this. So the first thing is, I do understand what you're going through, but I need a time for myself. To the mothers, to mom, honestly, I really loudly want to say that. Take time for your well-being. Yes. Take time for yourself. You will not be considered selfish if you pull yourself from everything and go for a coffee or just sit in room where nobody is there. If you have the right to say no, if your kid is saying, join this club and join that parent meeting and this, tell, yeah, I will, son, but I am quite busy, so I will pick one thing. Prioritize the important thing. It is not necessarily that if you're not in this parenting meeting, the meeting will be a failure. No. So pick what is most important for the family and for yourself and for the child. Jagruti, you won't believe when I asked particularly South Asian ladies and said that, so what was the last time you went for like having a facial or a manicure? Doctor, I think, and like, excuse me, you don't remember. If you don't remember,
that means there's no time for yourself.
You don't have the time. But I'm doing perfect with my kid, and how long you can do that.
Yeah.
The body and the mind is like connected to each other.
Yes.
You will be exhausted.
Yeah.
Take time out.
Yeah. You need to take that break. Yeah.
It's a 15-year-old kid. He can do a lot of things on his own.
Yeah.
Delegate those things to him.
Yes, absolutely.
I mean, and we're not talking about you have to spend tremendous amount of money and hire this and hire this. Few things we can work on.
Self-care is important, and prioritizing yourself is a form of self-care.
Exactly.
And everybody should do that, because I feel if you are healthy with your own mind, if you are happy within yourself, only then you can translate it in your other relationships.
Absolutely. Right? I mean, if I am stressful, it is a research proven that the parents who are stressful live under this lots of stress. They have the history of in conflict with the teenager a lot. They have a history, they will hit the child. They lose their own control, which is understandable. So what I would say, take time for yourself, where you can do things that help you to bring your emotions and your thoughts and at this moment. So instead of worrying about what's going to happen tomorrow, what happened, forget all that.
Yeah.
Bring yourself into this. So you do start yoga, meditation, whatever you want to do, just do it. Breathe.
Yes. No, that's absolutely important. As you've been mentioned about your own, episodes, you gave your own slight anecdote, the way you are with your children, your son, you're a mother at the end too. I want to know that how has your equation developed in this pandemic with your kids? What have you learned more about them? What have you learned about yourself? And what have you learned about the equation you guys share, what it needed to add it so that you had a better, healthier relationship? Because we're all learning, right, through the years, and then
It's a learning
yeah, it's
experience,
a learning.
parenting.
Yeah, absolutely.
Okay. Coming back to my own son, my biggest concern with the child is very introverted. He is getting very comfortable in isolation, online, because he doesn't have the challenges where he has to talk with the teacher. He never liked it. This is the way his personality is. So I deliberately used to put him in different activities where he has to be challenged. And this particular behavior that I'm just staying by myself, that was challenged in different manner. I'm not saying that as a parent, you and I have to change the personality of the child.
Right.
No, we are not working on that.
Right.
But if you see that this kind of behavior will become a hindrance, we need to do something. Coming back to the question, that when I saw this, I was concerned about this thing. So we try, as a family, we start looking what we can work on together that help him to be not to stay in his shell, not to stay in front of this 24/7 in front of this laptop. With that, we start creating, Jagruti, those games that we used to play during the lockdown.
Oh, nice.
And one was that because the shops were closed, everything was turn off. And I said, no, we need to be in the garden. We have to do something.
Wow.
So what we need to do? So we made what do you call that? Frisbee.
Yes.
And we made it on by ourselves. And one reason was that I wanted this like a family thing. We could spend time together.
Right.
The other thing, so we created lot of games. And it's a matter of the creativity and go online and see where you work together as a family. Now, that doesn't mean that you don't want to give a space to the child. He's a teenager. He needs his own time. So from this to this time, you do whatever you need to do. And after that, from 4 to 6 or 4 to 7, it's like a family time. So bring those things that we can do with you. We can play. And now when this was one that like be creative as a parent. Don't go and buy expensive things and just give to him and say, okay, play and get involved. Now, obviously, as a mother, I was also busy online teaching and all that. So I make sure that this is the time allotted to you. So this time we all be together and do something. So if you look objectively, we structured the day.
Right.
So when you wake up in the morning, you cannot sit on your bed and use the laptop because you'll be from 8 till 1 o'clock.
Absolutely.
So you need to be off. Even a slight shift of body help you to elevate the mood.
Absolutely.
So you make a structured timetable, a routine. You can't have breakfast 9 o'clock, 10 o'clock, and then study, and then go back to the bed. No, you can't. So once you leave, get ready, feel a little elevated with the mood, sit on this chair, take the lunch at this time, play this time with me, talk to this with the father. So the first thing, keep in mind, the more you structured and more routine you make, the better you will cope with the pandemic and the lockdown. It's just a shift of the mood. Now, things get all open, things get better, and the second lockdown came.
Yes. Yeah.
So it was not easy. And imagine for a child who, I think my son has started going to school for 3 months, 4 months, and then back again lockdown and all that. So this shift was very confusing.
Right.
It's very uncertain. It's lots of anxiety and provoking. But again, I moved back and put that 1, 2, 3. Now, with the children, they don't like an adolescent lecturing. They hate. And if you come my home, in every corner there is 1, 2, 3, 4. It's written. You can't come back to me and say, Mom, I forgot. Well, it is written there. One time you forgot, I will remind. But if you're completely forgetting it, then something is wrong. Make it a routine for them. Make sure it's 1, 2, 3. If they're not agreeing on that, come up with a plan that if you do this, we can give you a reward on that. Reward, not necessarily a bribing. We are not talking about 10 rallies.
That feels good, if you get something.
We can make it in a way that, you will get more time to watch this particular show.
Absolutely,
TV. Yeah. And I will be watching this half an hour video with you, or I'll play a game. So you can just modify different ways. But the routine is spending time talking about this and structured, make it in a structured way. And then you have, get them into online, which you always wanted to do something. Like let's say, I recently talked to him about that. Why don't you get yourself into what you call, where you, like in a debate competition,
right?
And it's online thing.
Right.
It's very cheap.
Yeah.
So I'm not letting him off that you getting too comfortable with lying down and becoming into your shell, because then getting out in school this transition will be hard. So get into that. So he found this Toastmaster.
Yes.
It's a kids things too. So you find ways that they are not,
to keep them involved and to work on their skills.
But don't expect them 5 hours sit in front of that because I have to do this. They will not listen. Because if mom is watching TV all day, then why not me?
Absolutely.
What's wrong in that?
Absolutely.
So I'm searching my TV and I am making sure that I am studying. So you have no reason.
Yeah.
So, I am aggressive in my conversation and I am playing a blame game and I am with everything snapping here and there with my stress. Trust me, my son is going to do the same thing.
It'll translate back there.
Who else is going to copy?
No,
He's copying me.
Absolutely.
But what happened that I don't want to look myself because that's my defense mechanism. But if I see in my kid, I will tell them that, this is wrong. Well, how about you, mom?
It's a little hypocritic, but
this is how it happens.
That's true.
So therefore, I'm saying the first thing is get self-aware.
Right.
Develop the self-awareness. Where my emotions are going, what is making me so mad? It cannot be my son.
Right.
Probably I'm struggling with something. This is a classic example. I had a divorce. And one time my daughter, who was, I think at that time 15, she told me something and I started lashing out. And I was like, do you realize that how much I have to do for you and nobody's helping me? I am by myself. And then I went for a long lecture and she looked at me and she said that, Mom, don't bring your dirty laundry on me. Don't bring your past into the present.
Wow.
Because this is already done. The divorce is done. And you are lashing on me, not because I did something very small. You are lashing on you because you are not dealing with your own internal emotion. And I looked at her and I was like, oh my God, what a lesson she gave me.
She acted like your therapist.
And that was like the last time when I brought the past into the present. And I said, I think you're right. You're right about that. It's not about you. It's about me. I have to work on myself.
But that's the maximum time, whenever we lash out at someone, when we're angry with somebody, when we sit down and analyze, it's because of something that we cannot deal with ourselves and we're blaming the other person.
Yeah. Have you heard that phrase in Psychologist, very common? If my boss gets mad on me, I'm going to hit my cat. Because I can't do anything with the boss, but I can take my frustration out on the cat.
Because the poor cat won't do anything to you.
So that's a healthy way. Now, if you ask the first question that you asked me, that how about the therapy and counseling, here would we make a difference.
Yes.
We make you self-aware that what is happening at that moment with you. Probably you can have a better lifestyle, a better coping mechanism, a better way of handling things.
Yes,
so
absolutely.
Again, pandemic is bad, but it teaches a lot.
No, absolutely. It's taught us so much.
So much. It's you and me that what we want to pick from it. So we can sit and sulk, or we can find out, this I never thought about myself.
No,
it's like a lot of self-awareness, pondering on ourselves.
100%.
We got a chance. We never got a chance to do that.
We never did. Yeah. So
if this came.
Yes, absolutely. So my last question to you, how do you deal with your own mental health issues? Because as a psychologist, you're also a human being first. There's so much that you are going through. When your daughter is not there to give you her therapy, how do you cope up with it?
Right. She was a good one. But that one really hit me hard. And again, coming back to you, you are so right about. I'm a woman. I have kid. I raised a teenager. I'm raising a teenager. I have a husband now, and I'm teaching and working. So there's a lot of things. So stress stay with me. Now, if I am teaching my client that be aware of yourself, learn what is happening with you in your emotion, I cannot teach that to anybody until I know myself.
Absolutely.
So the first thing, the primemost thing that I need to understand is what I am reacting to. So if you're sitting with me and telling me that, Nishat, you want to travel? And I'm no, I can travel. I can go home because I Corona will come to me and I'm vaccinated. But if I keep going, so the main thing is this, am I really dealing with Corona or I am dealing with my anxiety?
Yeah.
So I'm not dealing with Corona, I'm dealing with my anxiety. So the first thing, the important is that, am I getting aware of what is happening with me? Am I getting aware of what I am thinking? So giving you an example, if I am coming to your home and I miss the traffic that came to me, and Muscat traffic sometimes is horrendous. Traffic, like the lights are red, and I am struggling, and I am so cautious about. I'm so anxious.
Yes.
So this is my body language. I'm frustrated and biting my nails. My emotions, obviously, I'm very anxious. I'm frustrated. I'm cursing why did she make this appointment this time? She doesn't know that this is my anger. So I will pick anger. I pick my body language, that's what I'm going through. I pick my behavior. I'm going to pedal the car, drive fast, or I'm cursing you or whoever I have an appointment. Now, Jagruti, is the time I have to pull myself and ask, what are my thoughts? What am I thinking? Is this about the lady I'm going to? Is this about my appointment? Is this about the traffic or something else? Because these are the external factors. What am I thinking? If I get late, she might think I'm such a lousy. I'm so irresponsible. I have to be on time. And if I am late, she might think I'm always late. I am struggling with these automatic negative thoughts, which we don't create. It's just pop up.
Absolutely.
So when I pull that in for a second, well, I don't get late every time. This is the first time I'm getting late. She might not be thinking, because I'm reading your mind.
Exactly.
Probably
maybe she's not even thinking that way.
You might not, but my thought is, because we are the people who live a lot about what others are thinking.
And you're assuming things.
An assumption is not reality. Assumption is my thought. So the question is, am I assuming? Or is this just my thought? Or it is a reality, evidence-based thing? This shift, just a shift in the thought, what I can do is, most likely I pick the phone and I tell, you know what, I might be 10 minutes late. And you tell me, Nishat, it doesn't matter. The whole scenario changed. Traffic is still there. I am still in the same place. But probably my interpretation of the situation is different. Right. Get aware of your thought. Come, pull yourself into this moment. Because this is the moment when you are breathing.
Absolutely.
And the heart is beating.
Absolutely.
You don't know what's going to happen next. So when you become aware of emotions, you become aware of your behavior, you bring all your senses. What am I seeing? What's going on with me? And I think this is one thing helped me to cope with many of my failures and disappointments in life. Because I have to find out, who am I reacting to? The situation or my internal thought process? And that is my therapy intervention as well, which is called a cognitive behavior, where I teach people to challenge and learn the evidence of your own thoughts. Are they really real? Or they're just making
They're just made up,
It just came. It's like a bubble that is everywhere.
And then you just make it into a big mountain and thinking that it's,
So it's like a catastrophizing. And if you have a time for 2 minutes,
sure.
The same daughter who is my therapist, she is in the United States, in Chicago. And I want everybody to listen to that. And this is coming from a therapist. And when the pandemic hit, America was really in a bad situation. And she was in New York. At that time, she was studying there, and all of a sudden, Jagruti, and this is without exaggeration, I was thinking a lot about, and I wanted her to come flights closed and I can go, she can come. And I kept talking to her and she was like, oh, I have to go there. And I said, you need to stop your movement. And she's a teenager. She's 20, 21, a year, 2 years back. And she's totally on her own. And I realized all of a sudden, one day in the middle of the night, I woke up. My heart was beating like a racing. My hands were shaking and I was sweating. And I was very scared. And I was like, I opened the light and I felt that what is happening with me? What is going on? And I realized I am thinking about if my daughter get corona. She's in America. She's not with me. Now here, because I can go, she can come. The next emotion was feeling of helplessness.
Right.
So now there are three main things caught me.
Yes.
That
Fear,
the fear is there,
anxiety,
anxiety is there, helplessness is there, underlying sadness because she's not with me. Body start giving a very strong messages to me that come on, wake up, what is happening with you? And I'm searching, and I am sleeping and woke up in the middle 3 a.m. I'm a therapist. I teach people. So I stayed there for some time and I said, these are my thoughts. And my thought is making me believe that she will get the corona. And this is all the automatic is coming and going. And I'm struggling with that, which we called as catastrophizing. So that time, and I wanted people to do it and see the result. I took my notebook. And I start, what worse could happen?
Right.
So this is now decatastrophizing.
Right.
So the worst has happened, she could get corona. Okay. If she get corona, is she going to die? Not everybody dying with corona. So she's a teenager. She's in healthy, safe hand. So most likely, if she gets corona, she will be in the hospital, get the treatment, leave. What are the chances in a statistic percentage she will get corona? Probably 30% because of the age and the safe environment and all. It's not very high. So what could likely happen? She might happen, but she will not land in the hospital. She has the relatives. Her father is there. Her stepmom is there. She can be with them. And I think that was the last night
that you got
to woke up and I realized that, I was struggling with these automatic negative thoughts. And this is the worry and the anxiety because I was not in this moment. Presently, she is fine. So when I called at that time, I said, you're fine, you're okay? She said, yeah, I'm fine. I'm in dad home and I'm doing well. And that's about. So what I was worrying, I was struggling with this negative thought, which was like a monkey sitting and telling your daughter will get corona.
Yeah.
So catastrophizing moved to do catastrophize. Just narrow
it down. I think we have to deal it with logic. You have to do it with logic and reasoning. That, okay, I'm thinking this, but as you rightly said, what are the chances? Let's talk about it. And I think it is so important. And this is something that even I do, because there are times when even I think about the future. If I'm getting into a client meeting and I was like, oh, what if he says this? What am I going to do? Oh, what if he says that?
Oh my God.
But now, and believe me, it's been a couple of years now that I have started breathing and practicing.
Perfect.
Whatever happens, it's fine. And believe me, even when I'm going to a meeting where there is a problem and I'm going there to face the client who is very angry, but I go with this mindset, it's only a client, it's only work. What worse can happen? And you won't believe, because I have this mindset and this energy, it's all perfect.
It is.
The client is all calmed down. Yeah, Jay, it's all right. It's nothing. It's work. But if it's all about attraction. If I'm all worked up and negative, I will attract that kind of energy.
The mind never takes. Like, think about that. If you have very good time with mom and have one conflict with mom, the negative conflict is gonna pop up.
It's the one that's going to remain. Yes, no, absolutely.
One thing I want you to today, all of you as well as you, remember: the more you go into the future, more try to fix the future, the more anxiety and worry you bring in the present.
Absolutely.
The more you go in the past, the more sadness and guilt you bring in the present. So we teach people stay in this moment. Because this is the moment when you and I are alive.
Absolutely. We don't know what's going to happen in the next moment. So those were some amazing words and
Yeah.
practical, ways.
It's
to
very
deal with
practical.
things.
It's easy to say, Jagruti. I don't want to get a wrong concept that it is going to happen like that.
No. It's practice, practice, practice. We have to practice.
We have to practice. So the people who come to us, to me, like a psychologist, these are the tools they get from me. And it becomes like a lifelong with them, stay with them, because the mind has this capacity to change.
Absolutely.
It is just that what am I feeding to this mind?
No, absolutely.
So we all go through this, and it's not that you and I don't get anxious. I mean, if I'm
of
sitting
course,
this example I can never forget with my daughter, because I felt that it really hit me hard.
Yeah.
And I was saying, oh my God, my heart is going to close. It's going to just shut down, and I'm going to die if I don't see my daughter. And I'm really, is it COVID? Or it is my anxiety? Is it a monkey sitting in my mind, a monster telling me that your daughter will definitely get and she will die?
It's all our mind, our monkey mind.
It's a monkey mind.
And thank you so much, Doctor. I mean, this was amazing. You gave us so many tips, so many ways to deal with our own emotions and to practice living in the now, so that these monkeys, don't pop up, and we can control our emotions, because everything is created by our mind. Thank you so much. This is amazing. I hope all of you have learned a lot, and I hope this episode has given you a lot of perspective, a lot of reflection. Please do contact Dr. Shams if you need to. I will definitely put the links to her in the description below. And thank you so much for joining in, and I hope to see you in the next episode. Thank you for tuning in to today's episode. If it has inspired you even slightly, then please like, share, and comment. See you on the next one. Until then, remember, our time is limited. Let's make the most of it.
Hi, this is Dr. Shams. You are watching me on You Are Human. Please like, share, and subscribe to the channel.
Keep watching You Are Human on YouTube and listen to these amazing conversations on Spotify and other audio platforms.